into a space where beauty meets authenticity and transformation is not just a possibility, but a promise. I'm absolutely thrilled to introduce you to someone truly special, Dr. Rukmini Rednam, the compassionate force behind the countless remarkable transformations in the vibrant city of Houston, Texas. Picture this: every curve, every contour crafted with care and expertise, not just by a board-certified plastic surgeon, but your very own cheerleader for self-discovery and confidence. Get ready to embark on a journey where we explore the art of science of feeling your very best self. This isn't just a podcast. It's your cozy corner of empowerment and inspiration. So pull up a chair, pour yourself a cup of kindness, and let's dive into the Confidence Doc podcast with Dr. Rukmini Rednam.
Welcome to the Confidence Doc. I'm Dr. Rednam. I'm a board-certified plastic surgeon in Houston with my Houston surgeons. And today I want to talk about something that everybody has, well, almost everybody has, but everybody has a problem with sometimes, and that is insurance. Insurance is a very difficult conversation sometimes, right? Most people will tell you that you absolutely need it. Some people can't afford it, and others feel like it's what's the point because they don't approve anything. As a plastic surgeon, many do not work with insurance, right? But I am a plastic surgeon who does work with insurance. And the large reason I work with insurance is because I do a lot of surgeries that insurance not only should, but absolutely is legally required to cover. So what are some of these things that I'm talking about? I am a breast reconstruction surgeon. Breast reconstruction in the United States is an absolute right for women. That was a law that was passed, and a lot of people don't know that. A lot of people don't know that is because if you perhaps live in a smaller area, it might not even be something that's discussed with you. And to me, that's crazy, right? If somebody, and I'm going to be straightforward this, if you are a man and you lost your testicles, I guarantee you someone's going to talk to you about what potentially could be done for that. So the idea that if you're a woman and you lose your breasts, that somebody wouldn't talk to you about your options just seems kind of crazy to me because pretty similar circumstances there. I think that there is better and better education about it. I think that because of social media and because of a lot of different channels on the web, that like there's a lot more information for people to learn about it. But at the end of the day, breast reconstruction is still something that I think is often underutilized because people just aren't aware that it's available. I think that when we talk about breast reconstruction in the context of insurance, I am so surprised at how many people think that it's considered cosmetic, right? You're born with your breasts. They are part of you. And whether you choose to have them reconstructed or not should not be a question of, can I afford it? It should be a question of, do I want it? Or is it something important to me? Right? So I think it is an important point, and I will say it again, it is absolutely your right as a woman, if you have breast cancer, to have reconstruction. If that's something that is not available to you or not offered where you live, please just get on the web. Send me a message. I will help you find somebody close to you. From that standpoint with breast reconstruction, there is a lot of resources out there. You can go on to plasticsurgery.org. That is the official website of the American Society of Plastic Surgeons, and you can find a plastic surgeon who's near you who does breast reconstruction. So I will say that that's kind of my segment on breast reconstruction. Let's talk about other things that have to do with insurance. There are a lot of basics things that people use insurance for, like their primary care visits. Things like going to get your checkups, right? Pediatrician visits. When you're sick, you go to the doctor, right? A lot of people don't understand, though, why plastic surgery sometimes isn't as straightforward, right? So when you have certain plastic surgery procedures that aren't necessarily cut and dry, whether your insurance will cover it, what most offices will do is get a pre-authorization or a pre-certification. What this means is that your plastic surgeon sees you. They write a letter to insurance. They might have a lot of supporting information. So that means information from your primary care doctor, information from a physical therapist, information that basically says that something is medically necessary. And as such, your insurance needs to cover it. Well, that also gets a little bit difficult because, well, how, how do you define that? So I will tell you, if you have insurance, you can go online and it's all defined for you. It is not hidden, right? So let's say you have Blue Cross of Texas. I live in Texas. You can go on there and you need a breast reduction. You can go on, you can see the exact criteria needed for you to get that breast reduction approved. If you don't meet that criteria, it doesn't matter if there are other things outside. Generally, it will not be approved. So it is not hidden, and it's not something that magically one plastic surgeon knows and another doesn't. I think that the best way to really know whether you can have something covered by your insurance is to do some research, do some work. And it is, again, it's not hidden. You could Google, you can put it in Chat GPT, and they can get you to the right source. So insurance in some ways is not as complicated from an approval standpoint as you might think. But again, plastic surgery is a gray area because sometimes, let's say as a woman, you want a breast reduction, you feel like it will help with your symptoms, your primary care doctors told you to help with your symptoms. But I have a lot of patients who will come to me and they'll say, you know what, I do want a reduction, but I don't want to be too small. Well, the problem that comes with that is that depending on your insurance carrier and your plan, they may tell you that based on your body surface area, so that's your height and weight, they calculate your body surface area, that a specific amount of tissue needs to be removed. And for some women, that might be smaller than they want to be. In the case of insurance, if that's what you're wanting and you're hoping your insurance will cover it and you meet the medical criteria for it, you have to remove that amount of tissue. Otherwise, they can then, after the fact, see your pathology report and say, gosh, this was cosmetic because you didn't actually remove the right amount of tissue. And that is a hard concept, I think, for people sometimes to understand and wrap their head around. But that's what comes when you want your insurance to be able to cover certain medically necessary procedures. My tongue is tied today. And so it's understanding that it's not trying to be a stopgap. I know with my office, sometimes people get frustrated. They're like, well, I just need to talk to the doctor. And I just need you to understand that it's not me who approves these things. It is the person at the insurance who gets your file. It may be a doctor, it may be a nurse who looks through all the information and then based upon their criteria determines the medical necessity of it. In the past, you could have just one letter from your primary care doctor that said, I feel this will be beneficial, and you get approved. But things have gotten very, very strict with insurance. And that leads me to my next point is the frustration people have with insurance, right? What is medically necessary is very rarely determined by me. Right? What is medically necessary is very rarely determined by your primary care doctor. That is determined by that criteria I spoke about before by your insurance plan. I use breast reductions as an example as a plastic surgeon. It's something I know a lot about. But this could be any type of surgery. This could be life-saving surgery. This could be life-changing surgery, as in the case of my weight loss patients, where a surgery like a paniculectomy, where you're removing that lower skin apron that can cause infections, rashes. I've had people that I can't believe did not get approved. And then I've had other people who I was like, surprise, insurance approved. So even though this criteria exists, it's still at the end of the day, you are at the mercy of your insurance company to determine whether it is going to be medically approved. This can happen with MRIs. This can happen with lab tests. These are things that I may not deal with as much as a plastic surgeon. In my general case, it's surgery. But let's say you're getting your gallbladder taken out. That criteria might be more straightforward and much more easy. And so that's why often a pre-certification or predetermination may not be necessary. But because of how gray plastic surgery can be and how much criteria they put on us for approvals, that's where it gets really tricky. And that's why most plastic surgeons will say, we need you to do this beforehand. We need to make sure it's approved. Otherwise, you might end up with this huge bill that you don't want from any of us, whether it's the plastic surgeon, the hospital, the anesthesia provider. At the end of the day, we're really doing it to protect you and make sure that you're in a position where you know exactly what's happening. So trust me when I tell you we're on the same page with things. It is towards the end of the year. Why I chose to talk about insurance with this episode is the end of the year becomes crazy where insurance. Everybody wants to get in because deductibles are met. Now, there are some people who have deductibles that are mid-year or off-season, but for most of you, your deductible ends at the end of the year. So that means that anything you've paid out, anything like that, maybe you've already met your deductible, and so you're excited because that means that you can have a procedure and you don't owe anything if you have a plan that then covers 100% once that deductible and out of pocket are met. These are terms that if you're like, I don't know what you're talking about right now, these are things you should educate yourself about. I get a lot of younger patients who have no idea. They know they have insurance, but they don't know what these mean. So let's review these terms a little bit. Deductible. So your deductible is very similar to if you have car insurance. It's what you are going to have to pay. Often you might have to pay the whole thing. You might need to pay a portion of it before you were to have a surgery, a procedure, things like that. I'm saying in the context of surgery because that's what I know, but often there can be other procedures that are not done by surgeons that may still require your deductible be partially or totally paid. Your out of pocket now is a total number, right? Your out of pocket could be much higher than what your actual deductible is. So your out of pocket has to be met before your insurance company then says, hey, you don't need to pay any portion. So sometimes even if your deductible is met, if you still haven't met your out of pocket, they may pay a portion of things, but you still need to pay until that out of pocket is met. Usually plans that have a very low monthly payment have a high deductible and a high out of pocket. That's why your payment's usually really low. Plans that have a higher payment on the front, once that's made and your deductible is high and is paid off, then you might actually be paid off and not have to pay anything afterwards for a while. These are things that I did not think about when I was in my 20s. And so hopefully this is a very, very basic, okay, this is what these mean. And they're things you should always know, especially when you're going to see a surgeon, not just a plastic surgeon, any surgeon. So you understand and it's not a shock of, oh my gosh, how much do I owe? It is very common for us to get contact forms where people say, hey, I just want to have an idea of what the max I might owe is. Well, that's something that hopefully when you sign up for your insurance, that's something you should know. It's not something you have to ask the doctor's office for. You can sign in, log in, and look up and see what it is you might owe. Now, you may not owe your max deductible or your max out of pocket for one procedure, but these are things that you have at your fingertips. And I think it is really important as a person who has insurance to understand your insurance and be an informed person, just like you wouldn't go buy a car and not have any idea about it. Same thing with insurance. Have an idea about it, educate yourself about it so that you make sure that you are maximizing what you can get and you really understand it. And so then it doesn't feel like, oh gosh, I'm at the whim of what other people are thinking about. Finally, let's talk a little bit about why people hate insurance, right? Why do we hate insurance? Because, again, we feel helpless sometimes. We don't have education about how exactly our plans work. And at the end of the day, we get upset when we don't get approved. Recently in the news, and when I say in the news, literally this happened today, the day I'm recording this, the CEO of United Healthcare was shot. And it's been very clear that while they don't know exactly, they allegedly feel that this has likely been a hit. Why would you go and shoot the CEO of United Healthcare? Well, all those things I just talked about, people are frustrated. They're frustrated when they feel they have something medically necessary and it doesn't get covered. They feel like they have to pay high deductibles, high premiums, and it becomes frustrating because then they feel like at the end of the day, I pay for this, why can't I get these services while people at the top seem to be getting richer and richer? And as a plastic surgeon, I do things that are life-changing. I don't know that I'm necessarily always doing things that are saving people's lives. So I've had people feel that way about things, but there are life-saving things that are getting denied. So I think that we have a long way to come with insurance in the United States. I can't tell you that I have the perfect solution for it, but I can tell you that the first step as a patient and as a consumer is to understand what is available out there, understand how insurance works. These are things you can learn about on Google. And then it helps you better understand what your rights are as a patient. So hopefully this was a little bit about a lot. Hopefully this was something something that taught you a little bit about a very big subject. I know I've covered a little bit about like what plastic surgery related insurance, a little bit about the basic terms with insurance, but this is something that every person, I think, especially as an American, should know about because little by little, insurance is slowly denying more and more and making things harder and harder for things that I think are basic human rights. So, if you are an insurance company listening to this, I think we need to do better. I think we need to be more open about things. And I think that we need to really listen to what we need to do from a prophylactic standpoint to take care of the citizens of this country. I know there are so many more questions out there, and I will get off of my soapbox about insurance for the moment, but I would love to hear from you all. I'd love for you to leave in the comments below questions that you'd like to answer, things that if I don't know off the top of my head, I will do the research for you. But let's learn more. Let's get more educated on insurance.
As we wrap up another episode of The Confidence Doc, I want to extend our heartfelt thank you for being a part of our community. If today's conversation resonated with you, remember that Dr. Rednam and her team are here to support you on your journey to self-confidence and beauty. Your story is unique, and it's our privilege to help you create the masterpiece that is your life. If you'd like to book a consultation with Dr. Rednam, you can visit her webpage at drrukminirednam.com. Fill out a contact form, and one of her coordinators will get with you accordingly.